I think.
Do it.
All right. So thank you everyone for coming. Janae and I posted on our private page that I had taken this seminar and there was so much interest. Janae reached out right away and we decided we needed to present this information to all of you wonderful athletes and women. And so we have here for you considerations for female athletes. So we're gonna keep everyone on mute throughout the presentation. And if you have any questions, just type them in the chat box that's gonna be towards the bottom of your screen. There's a little chat bubble. Just type them there. We'll either address them as we go or at the end, however that fits in. Most of this information we're giving you tonight is gonna be generalized for all women, obviously, but some's gonna be very specific to athletes that are menstruating. Synthetic hormones such as birth control affect the cycle differently, especially oral contraception. So we're not going to be speaking to that as much, but there is definitely a topic we can go into at a later time. So first of all, women are not small men. I'm sure we all know this, but in a lot of scientific research over the years, they've just generalized studies that have been done on men and just categorized us as small men and given us recommendations based on just being small men. We are smaller, we are lighter, but we have higher body fat percentages because we're built for growing and keeping babies alive. So our body fat percentage, essential body fat, is 12% compared to men. However, we do naturally burn fat better than men during exercise. Our metabolism just goes back to normal quicker than theirs does. Ours is about 3 hours compared to men's. Their metabolism can stay heightened after exercise for up to 20 hours, I think it is. It's a really long time and it seems not fair. They lose weight faster, we all know it. We do have a smaller heart, lungs, lower diastolic pressure. Of course, you know, everything in our body is smaller because our bodies are smaller. Less oxygenated blood, that means we have to breathe more often, meaning our muscles have to work harder during exercise. But we have larger type 1, which are slow twitch muscle fibers, which are better for endurance, which I was really excited to learn. So the further you go, the better we're gonna do compared to men. So you're gonna see, you see here a chart of a typical, what they call a typical cycle, which is 28 days. So they break the cycle up into 2 main phases. The follicular phase is going to be the first day of your period until you ovulate, and they generalize that around day 14. And then after that is the luteal phase, which is ovulation until that last day before your period starts again. And you'll see there's the lines here for all of the different hormones. See how they peak right before ovulation, and then some of them flatten out and then others rise, and we're going to get more into that. So that first phase we talked about, the follicular phase, is a low hormone level. So progesterone and estrogen are the main hormones that we're talking about. And surprisingly, that follicular phase, that first few days, especially when we're starting our period, our physiology and our hormones are more similar to men, especially with our metabolism and recovery. And our hormones are more favorable for performance during that time. So the couple of days right after you start your period are actually the most favorable in a typical woman's cycle for performance. So all of our lives we thought, oh no, I hope that my period doesn't start right before my big race, my big event, but our hormones are actually at a level that would be to a benefit for us. And then also during this phase, our immune system is heightened, so we have a better immune defense. Then the next phase is our high hormone phase. That's the luteal phase. That's going to be when we ovulate until the next period starts. Your estrogen and your progesterone levels rise after ovulations, which is causing your fluid to shift into your cells, decreasing your blood plasma, and that makes you bloated. That makes exercise feel harder than usual, causes a lot of lethargy. I know that when I'm in this phase, everything just feels like it's a little bit heavier. It's harder to pick up my legs. And it also, the surge in estrogen suppresses our immune system, which can be a compromised immune system as compared to the follicular phase. So we're going to talk to you today about our 5 pillars of health and how they pertain. Each of your phases of the cycle pertain to these pillars. So I'm going to hand it over to Janae to get us started on that.
Great. So the first pillar that we're going to start with is fitness. Fitness is something that all of us are generally pretty familiar with, since that's kind of the reason we've all been brought together to begin with. And to piggyback on what Megan said earlier about how women are not just small men, there's 3 things that are specific to women that are really important to consider when you're talking about your physical fitness. So the first thing is pelvic positioning. Women tend to have greater anterior pelvic tilt, which means that we have a slightly weaker posterior chain and an exaggerated lower back curve. So these are things that you might want to consider working on strengthening your glutes, your core, and your hip flexors to help with this. The second is landing and knee biomechanics. Women tend to have increased knee valgus, or your knees point in. So when we're talking about things like squatting and lunging, you want to focus on having correct knee alignment and being really careful treating your knees well. And then finally, changes in neuromuscular control. So as our hormone levels change over the course of our cycle, it actually affects the way that we move and our coordination, reaction time, the way that we think and process information around us. And it's important to keep this in mind because there are certain things that require more complex coordination, higher skill movements, things that might feel really good one day and might feel really awful the next day. So if you know that maybe it's related to where you are in your cycle, it might help lessen your mental stress over it, which is something else that we're going to talk about later. So in terms of what your cycle has to do with your fitness, we're going to dig into that just a little bit. Research has shown that the VO2 max and lactate threshold are constant across your cycle. These are really jargony terms, and what they really speak to is the level of exercise intensity that you can sustain based on how well you intake oxygen and how well your muscles deal with lactic acid, how quickly it builds up. And they don't vary a whole ton across the 28-ish theoretical days of your cycle. So you can theoretically engage in high intensity exercise the entire time. Of course, like Megan mentioned, there's emotions and stress and other things that come into play at some point. So just because you can engage in all types of that exercise doesn't mean you have to. There are some notable differences that run across your cycle for menstruating athletes, though. So we're going to talk about each one of those 4 phases really briefly. So while it might seem counterintuitive, like Megan said, the first phase is actually your peak performance phase. This is where your exercise physiology is most similar to that of men. Your cognitive functions are highest here. It's a good time to work on your skills. It's a good time to work on things that involve coordination. Great time for high intensity exercise and strength training. It's also good because exercise can help reduce your menstrual symptoms. It might make you feel better to move by releasing some of those endorphins. Phase 2 is your high energy phase. So this is a phase of increased strength when your body is best able to repair and build muscle tissue. You might experience better recovery, faster recovery time, adapt well to both high intensity and strength training. Phase 3 is when your body temperature starts to climb. So as those hormones start to shift, you'll notice that you might have increased breathing rates, increased heart rates. This is going to be both at rest and during your activity. Your body might take longer to recover from exercise here. You might feel some delayed onset muscle soreness that you don't normally get, but it's actually the best time to work on endurance training, like Megan said. Low and slow here is the best way to go. And then during phase 4, when your inflammatory response kicks in, this is also a time that's going to make it a little bit more difficult for you to recover. So it's a good time to think about dialing in your recovery and your nutrition, but also a good time to keep moving even when you don't want to, again, because of that endorphin release, which can help reduce your PMS symptoms that we've all come to know and love so much. And I'm going to hand it back over to Megan, who's going to talk to you about nutrition importance.
All right, so next pillar is nutrition. So there's a lot of different diets. This is generalization. Everyone's going to have something different that works for them. One really popular thing right now is fasting. And I do know it works well for some people, but fasted exercise, especially fasted exercise, but fasting in general is not optimal for women. And I put the example here of a study that created a calorie deficit for both men and women, 3,500 calories deficit, either by dieting or by exercising. And it showed that when that deficit was created by exercising, the women's appetite remained stable. But when they try to cut the calories by fasting, eating less, our hormones were affected more than a man's, and our appetite spiked. So women ended up getting hungrier and eating more as a result of the calorie deficit from fasting. So excessive within day deficits, so that's cutting too much out day to day, they're going to have negative impacts on hormones, metabolism, bone health, physical adaptation. So some athletes have issue with their periods going away. They find that they're not actually losing any weight at all because their body's going into this mode of save everything because it's never getting enough. And then our bone health is already, as females, is compromised, and by putting us in a deficit, it's affecting it even more. And then, of course, the physical adaptations, they're not going to come if we're not nourishing our bodies properly. So it's important to refuel. You hear this, your window of gains, you hear this a lot, but it is actually important for women to refuel. Approximately 30 minutes is that window. 20 to 25 grams of protein is a really good target to shoot for. And as women, it's recommended that they supplement with whey protein because whey contains leucine. Leucine is the amino acid that actually helps us build muscles, so it's helping with growth and repair of your muscles. Our protein needs are going to increase as we get older. It is more difficult for our bodies to synthesize protein as we age, so we just need to remember that as we get older, our need for protein is going to increase. And throughout menopause is when we also need to be concerned about carbs. Our bodies are going to use carbs differently also through menopause, so we need to think about getting carbs low on the glycemic index, so veggies and fruit first. And then, like I mentioned at the beginning when I was going over the phase, women are in their max fat burning phase in the luteal, so that's the ovulation to day 1. We burn fat at a higher rate during that phase. And then my favorite pillar of them all, sleep. Sleep is absolutely essential for us to recover. So a lot of negative side effects that come out of not getting enough sleep. I'm just going to touch on some of them right here. Lack of sleep just really is a detriment to our ability to adapt and improve our performance because we are repairing our muscles and growing our muscles while we're sleeping. So you'll hear a lot of recommendations, and actually Cade just posted a video today of a casein pudding that he was making, which he mentioned as a bedtime treat. And I actually just, before we started, finished eating mine. It's really important to get that protein in the evening for your muscle repair and growth. So as this pertains to the different phases of our cycle, after you ovulate, when your progesterone is rising, the progesterone, extra progesterone in our systems can cause drowsiness. So you can get, just like throughout the day, a little more tired after ovulation, which goes hand in hand with what Janae was speaking about, where we're in that low energy, it takes longer to recover, we're just feeling a little not as perky throughout the days. And then just before your period starts again, those estrogen and progesterone levels start to drop again. That's going to cause, not always, but it can cause restless sleep in the days just before you start your period. And then naturally, women just had a shorter circadian cycle than men, and that may be linked to way back in our ancestral days when women were more staying with the family in a place and having like make sure there's a lot of research about why, but having to wake up constantly to take care of different members of the family is basically the way research is kind of framing it. So it's more likely for women to wake up early. They're more likely to be disturbed in their sleep, more likely to have insomnia, and then that also increases risks to female shift workers because of the way that their natural sleep cycles work. It increases the risk that shift workers might be injured on the job.
Before we move on to community, I just want to mention that we have Kara Stadhog and Emily Everett here from Kitsap Physical Therapy, and they helped us put this presentation together and are serving as our expert panel. So Kara is dropping some knowledge bombs in the chat as we go. So make sure you check that out for some additional good information. I saw tart cherry juice and that caught my eye. So the fourth pillar is community. So in the modern world, community isn't really considered to be as essential as it used to be in the olden days when women did laundry together down by the river and spent all of their time together, but really it is. There's a ton of research on the sociology of community and the sociology of friendship, and all of that research confirms that you're much more likely to consistently stick to exercise when you have a person or a group to whom you feel accountable. And we're all pretty lucky because we've got lots of persons and a pretty giant group to help us be accountable and be our accountability buddies. But it's also not just helpful because it helps us be accountable with our physical health, it also helps us maintain our emotional and mental health as well. Community, through community connection is really important and vital to our physical and emotional well-being. Personal interactions actually stimulate the brain, help the brain grow, keep those neurons firing, build connections in your brain as you build connections with people. So it's important to find people who will lift you up, help you grow, and challenge you to be the best person possible and to keep growing and learning and attaining new things. And finally, stress. I'm sure this is something that we're all also intimately familiar with. Stress is actually a major disruptor of your hormone cycle. So when you have increased levels of stress, your cortisol rises. This is your body's completely natural response to a perceived threat, but over time, it can cause your cycles to become irregular. So some things to keep in mind when it comes to physical stress. Women are super prone to overtraining. It takes us longer to recover from overtraining than it does for men. So pay attention to your mood when it comes to choosing your activities. If you're not feeling up to doing something, know when it's a good day to push past those negative feelings and know when it's a good day to listen to your body and listen to your brain and maybe take a rest day, go a little bit easier, spend some time on mobility. Just know yourself and get to know the signs of overtraining. Recovery will take longer in the 5 to 6 days before your period. Fitness strengths and weaknesses vary over the cycle, so try to be objective when assessing your performance and thinking about other factors that might have impacted that performance, not just your own ability. So if one day you can squat 100 pounds and the next day it's hard to squat 85 pounds, maybe it's just because of where you're falling in your cycle, not necessarily because your abilities don't exist. So this is a good time to talk about being aware of negative self-talk. Research shows that positive self-talk actually helps make us better. It helps us improve. Using your mind to visualize yourself achieving something or accomplishing something or succeeding at something makes you more likely to actually be able to do it. And then in terms of emotional stress, as 2020, the longest year ever so far, has reiterated for us, emotional stress is most definitely a thing. Our hormones affect our emotional state over the course of our cycle as well. So phases 1 and 2 are our big physical energy times, and they're also our big emotional energy times. Our body is giving us all kinds of feel-good hormones that have us feeling more energetic, more positive about things, more optimistic about life in general. And then as our hormones start their big shift into phases 3 and 4, you might start to notice that your energy level drops a little bit. You might start feeling more emotional, maybe a little sad and irritable through the end of phase 4. PMS symptoms actually increase our stress levels. So it's a good time to think about yoga, relaxation techniques, something to help keep your body on an even keel and keep your brain on track, and keep your sleep as a thing, because it's Megan's favorite thing. So make sure you're getting your sleep during those phases as well. Okay, so what can you do, Megan?
Oh no.
Your computer volume has to be on.
That's okay. If you haven't seen it before, she's telling you to worry about yourself.
I just figured out what you were telling me, Kara. And it still didn't work. Sorry.
It's okay.
Technology's a bitch.
You'd never guess that, like, I Zoom every day for work because I work from home, so I should be a pro at this. Anyway, so worry about yourself. One way that you can start getting a little bit more in tune with the way that your body works is tracking. So if you don't already, you might want to consider starting to track your cycle. A lot of wearables have made it really easy to do this. So Garmin just added it to their Connect app. There's an app called Fitter Woman that's pretty cool that gives you performance notes as your days change. You can also just keep it basic with pen and paper. There's not really any shortage of things that you can track, whether you're tracking your physical symptoms, emotional symptoms, fertility, body temperature, cervical mucus, bleeding, pain, emotions, cravings. You can pretty quickly start to recognize how your body and how your mind reacts to shifts in phases as you go along. So when I started tracking, I learned really fast that when I'm eating chocolate chips in one hand and pretzels in the other, then things are about to get real in my life. So I'm going to let Megan wrap us up now, and then us and our expert panel will take any questions that you might have.
All right, so like I said before, we're just painting, this is just a broad generalization. Everyone's different. We're all in different points in our lives. Some of us have had kids, some of us haven't, some are on birth control, some aren't, some have gone through menopause, all different, we're all in different places. So while this information pertains to all of us, we're all going to experience it in different ways, and that's why it's important to worry about yourself. Maybe it's just tracking the days that you're on your period. Maybe it's just tracking your emotions. Maybe it's tracking your eating habits. Like Janae said, I definitely notice when I'm craving salty and sweet and only want to eat carbs. Like I know that where I am in my cycle every month, even if I haven't paid attention to anything else. So pay attention to your body, pay attention to how you feel. I saw Judy's question, warn your husband, like, hey, this, you pointed out that I'm being crazy. It's because it's my hormones. So our potential next steps after this are creating a place where we all feel comfortable talking about this. We've discussed whether or not posting in the KCF private page is appropriate, and I feel like I don't care if men know about where I am in my cycle, but overall I think most of us would be more comfortable talking about that on our own and not letting all the guys in the gym that pay attention to the private page know, like, hey, I'm ovulating this week and I feel really awful and we're supposed to be doing a 1 rep max, So we were talking about creating maybe a Slack channel for all of us to chat on, and then having additional sessions like this, hopefully in person, where we can go deeper into different topics such as endurance, nutrition, menopause, pregnancy, and so on, whatever our community is interested in learning more about. I know I personally have a ton of information on endurance and pregnancy and postpartum, just because I've just come from having a kid and I'm an endurance athlete. Everyone might have different interests. I know Janae is more interested in the strength side of things, but she's also really interested in nutrition. Like, so we can all just kind of decide where we would like to go from here. But we definitely want this to be a collective, start talking about what we all want to learn more about, and just make it more normal to talk about these things, because I know that sometimes in the gym, we probably all feel the pressure to do the weight as prescribed or go a little heavier, even when we know better. And now maybe we know, maybe some of us know a little better, like, I should listen to my body and know better. And maybe you're not going to come out and say, hey, Cade, I'm ovulating. I'm not going to put up a 1 rep max, but you'll at least have the knowledge about your body to be able to make the best decision for yourself. So I guess we're going to touch on any questions.
Looks like Kara's may be able to respond to some questions about hormonal birth control and how that affects cycles. Kara, would you mind talking to that?
Yeah, I was starting to type, but talking's easier. So hormonal birth control is really going to and its effects on your body are really going to depend on the type of hormonal birth control that you have. A lot of OBGYNs or primary care physicians that are prescribing these will talk about them and say that they're bioidentical, but the problem is they're not identical to our organic hormones. They're still synthetic, and some people's bodies will recognize that synthetic hormone as the closest match to true progesterone, and some people's don't. So that's why you can hear a lot of women say they've tried a bunch of different types of birth controls. They had crazy side effects from them. They made them feel crazy, just totally off. And that can be because of your body's chemistry really not liking what this synthetic hormone is doing inside of your body. If it's specifically the pill, that hormonal birth control does not, when you go on the gap week where it's the sugar pill, your body is essentially having a withdrawal bleed from that synthetic hormone. Your body can only generate progesterone, true progesterone, when your body ovulates. And so hormonal birth control, that's the pill, 100% stops and prevents ovulation. And our bodies need progesterone. It's our calming hormone, right? It's what balances estrogen, which is our energy hormone. And so that's where a lot of like sleep disturbance and things like that can come from. If you're in kind of an estrogen excess state, or a lot of irritability, difficulty having your blood sugars balance. And so that's where kind of bloating and weight gain and breast tenderness and all of that can come from like the PMS side of things. Birth or hormonal birth control that is an IUD only suppresses ovulation about 85% of the time and is a slow release of the progestin, which is the synthetic hormone. And so it has been recognized to be like a little milder form of hormonal birth control. But if it gets you to the point where you don't have a withdrawal bleed or have a cycle that other 15% of the time, you can still follow other body signs depending on kind of your phantom cycle or your phantom phase. And so that's where you really have to turn inward to your patterns month to month. And so journaling can be a really helpful place for this. So if you're recognizing like, wow, I feel super gung-ho, I can tackle the world, and you have kind of a week and a half of that type of headspace, you may be in your phase 1, phase 2 part of your cycle. And then if you start to turn inward where you're like, I hate the world, like everyone stop talking to me, I don't want to go to the gym, I'm not motivated, I don't have the energy, and you have more of that trend of that, then you might more be in your phase 3, phase 4. So yes, your menstrual cycle is a vital sign, right? It's giving you some information about how your body is functioning. But even if you don't have a cycle, like you're in perimenopause and it's hit or miss if you have one, or even if you're in menopause, we still have hormone fluctuations. It's just we don't have that monthly report card to give us information about it. I know that was a long-winded answer, so I hope I didn't lose too many people there.
Mm-hmm. I thought it was really interesting. I wish I had done this before.
Judy, you asked what type of provider could help you with premenopause hormone balance. There's a Dr. Amy Anderson, who is in the, I think the Institute of Healing. I have her pamphlet. Hold on.
And if anyone has any comments or questions and you don't want to put them in the chat, you can raise your hand and I can unmute you as well. Or if you just want to say hi.
I think her clinic is called The Art of Healing, and it's just across the street from the gym in that medical clinic there upstairs from the Salmonberry Birth Center. She does a lot of work with individuals on supplementation for hormones to help balance those out and get you out of those big peaks and valleys. Other providers to reach out to would be naturopathic providers, or even looking to like acupuncture and herbal medicine to be able to look into that, because I'll be quite frank, most Western medicine primary care providers or even OBGYNs, lifestyle changes are not going to be their first recommendation. They're going to more recommend on the low dose hormone replacement therapy. And again, like it's synthetic. It's not true hormones. And depending on your belief system, you can do it other ways. It doesn't have to be through pharmacology. There's a lot you can do just from using nutrition as food, and looking at what are kind of hormone disrupting practices in your life, like excessive amounts of caffeine and alcohol and things like that.
Am I unmuted?
You are.
Oh, okay. So yeah, just this week I got rid of all fake sugar, like sugar-free, everything. And I'm exhausted. Like I took such a crash this week. Like plus my cycle's all jacked up. I turned 50 and I got like crazy periods for my birthday. So I did a shot of Floridix this morning, which is like an iron supplement, just to see if that would help, because I'm not relying on the caffeine either. So it's like I got no caffeine, I got no sugar, I got a good diet. Like what else can I do?
And give yourself about a 2-week period for those withdrawals to happen, because sugar withdrawals, it takes about 8 to 10 days, or just shy of 2 weeks, for your body to truly go through that withdrawal. We all know that sugar cane or even sugar replacements are just as addictive as cocaine. And so your body is going to go through withdrawal. And so at least having some acceptance of that, but committing to the process is like good on you for taking that step, and just persevere.
Right. And the tired, sometimes I can't distinguish the tired if it's actually physical tired or just emotional and mental. Like I just don't make me adult today, like I just want to do nothing. And I have to be okay with that, because sometimes like the type A in me wants to just go to the box and do more and push, and don't be a slug, and you beat yourself up for not doing it. And it's okay to not do that every day.
Yeah, give yourself permission to be where you are. Have you explored essential oils much at all?
No. No.
So essential oils is an area that I have a book I've kind of dabbled in here or there. But for things like energy, where you're like, I can't distinguish the tires, we all know that aromatherapy can be really powerful. So citrus oils, lemongrass, I have one that's called a romance blend, but it's just a really nice like orange zest. And so being able to have a little like spray bottle of that to spray in your shower as you're getting ready in the morning, or having a diffuser in your bathroom kind of at your vanity station as you're getting ready, or if it's you work from home and you're at your computer and you're starting to crash, like turn your diffuser on, or have the little vials of a base oil like jojoba oil or fractionated coconut oil, and have that in it, and you roll it on the soft skin areas of your body, like behind the ears or your wrists, even on the breasts are nice absorption areas. Get a little quick kind of whiff or hit of that, and you could kind of pull yourself out of that lethargy.
Mm-hmm.
It looks like Claire has a question about people with very heavy bleeding, whether they should back off because of anemia fears, or if they should suck it up and take advantage of that cycle. And Emily is giving her some information in the chat, but in case anyone else wants to hear the response.
I'd want to dive in a little further and kind of figure out why you're having such a heavy bleed. So when you say heavy bleeding, are you going through a tampon or a menstrual cup faster than every 2 hours?
Yes.
So that is considered like excessive heavy bleeding, and something that you definitely want to look into, especially it looks like because you're frequently getting anemic for that.
Yeah. Which I have been with my OBGYN. I was actually referred over to UW medicine for it. So it's something that I've been working on. I just, usually on my heavy days, I kind of just avoid the gym. But, looking at the stuff that you guys presented, and Emily was telling me in the comments too, is it best to just suck it up and take advantage of that phase? Which I have done. But it's just a kind of a battle with being a little bit anemic sometimes, and just feeling really tired and feeling like everything is heavy. And in that case, the iron is definitely not sharpening the iron going to the gym and trying to do things like that.
Yeah, I think I'm looking through here. So give me a second to find my section in my book on heavy bleeding and common causes for that. So you said you've been working with OBGYN and even having consults with UW.
Mm-hmm.
On the lifestyle side of things, what kind of recommendations have they had you try up to this point?
Honestly, they haven't really had much advice for me lifestyle wise. I switched from using tampons to using oh gosh, what's it called? It's like a menstrual disc. It's called Flex, which is able to hold more, and I can empty it without touching it, because I also have some other women issues going on. So I mean, they just recommend upping my dark leafy greens and getting some more iron rich foods about a week before my period starts. But I actually had I've had a couple of things that they've tried. One of them was an ablation that hasn't really helped. So, no, I didn't have a fibroid. I don't know if that was Judy saying something to me. I'm a little bit technologically inadvanced. Lisa ditched your uterus.
So in one of the books and kind of restoring a regular period, they kind of break it down into some general considerations to take. So if you're looking to nutrition, the main hormone disruptors that can contribute to excess bleeding are going to be caffeine, alcohol, dairy, added sugar, and soy. So
Okay.
that can be a tall order to try to eliminate all at one time. So I would
I've
say,
got 2 of them for sure.
I would say start with the easiest, right? What are you going to be most successful eliminating? It takes
Okay.
at minimum 2, at maximum about 8 weeks of an elimination to really see if it is impacting, and can be even further when you're talking about menstrual changes, because it takes 90 to 100 days for an egg to completely mature. So things that you've eaten, drank, stress states in your life 3 months ago are going to show up in your menstrual cycle now. So having that kind of compassion for the timeline of seeing changes, and know that, it's going to take some time to see that, is really important. As far as looking to kind of the main supplements that they look at, is supplementing magnesium, zinc, your vitamin B complex, your omega-3 fatty acids, if you're looking kind of for supplements. There's a really cool thing out there called seed syncing that can be really helpful for people. That was something that I explored and started when Mike and I were trying to get pregnant, because we were having difficulties there. And so there's certain seeds that you grind up, a tablespoon per seed in the phase of your cycle. So phase 1 and 2, which are basically going to be about day 1 through day 14, are going to be pumpkin seeds and flax seeds. 1 tablespoon a day. Ground is best, because that's where you're going to release all the essential micronutrients, which are basically magnesium, zinc, vitamin B complex. You can bake them into foods. You can put them in your granola, oatmeal, whatever breakfast that you're having. And then days 14 through 28 to 35, depending on how long your cycle is, it's sunflower seeds and sesame seeds. Go to Central Market, bring some mason jars, get the seeds in bulk, store them in the freezer. They're going to last a lot longer. Get a second coffee grinder. Again, you can find them at Central Market, I believe. And you can make them to serve per day, or make them in bulk, energy bites. But it probably fits into like some meal prep you're already doing. So that can be something you try as well.
That's fascinating. Okay. I'll give that a shot. Thank you.
Yeah.
Lisa, Kerwin, did you have a question?
Yeah. So you said something like, so I, like I said, I gave away my uterus, but I kept my ovaries. So I've been trying to like play with this, to try and figure out the cycle, but it's kind of like a guessing game. You said something like the sugar, when you're wanting the sugar and all the carbs and all of that, then is that right before the start of your cycle? Is that what, or is it like, does it go sugar, then angry, and then cycle?
Cravings are most often going to occur in the kind of PMS stage, which is going to be that week before your cycle.
Okay, that's when the cravings happen. And when does the angry happen? Is it the same time?
Correct.
Okay. And then when is bloated and gross in a week? Same time?
But still, yeah, that's kind of your cluster of PMS symptoms.
Hey, yes. Okay. Figuring it out.
A lot of times that is an expression of estrogen excess. So that means your body is not being balanced by its natural made progesterone. So fiber is also like, to continue to toot the veggie and fruit horn as far as eat your veggies first, fiber is so important in being able to help your body rid itself of excess estrogen.
Ooh. Okay.
So even being able to track and look at your poops. I teach my little kiddos how to choose their poo. And when you look in the toilet, it either needs to look like a smooth sausage or a hot dog, right? Long, smooth snake, or soft blobbies like chicken nuggets. If it's got cracks in it or looks like a bunch of grapes or little rabbit pellets, you are constipated and you are not getting enough fiber.
What if it's the other way?
If it's more on the loose side of things, then we got to play with what kind of fiber you're eating to add more bulk to your stool.
Awesome. You guys are, wealth of knowledge. Thank you.
So kind of to add a plug for Emily and I is like, these are the kinds of things that we can consult people on. I love my job as a physical therapist because I can't prescribe pharmaceuticals, right? So we have to look to your 5 pillars of health: your exercise, your nutrition, your sleep, your stress levels, your community support, and really kind of help people hone in on where you can use those pillars of health to support your health, or where those pillars are taking away from your health. And so where right now it would be hard pressed to have your insurance pay for that kind of physical therapy. And so we're looking at developing some kind of cash pay consult programs. And so this is definitely, as we're diving further into these things, if you're like, hey, I'd like to help sit one-on-one, sit down with me, these are the kinds of services that we're looking to offer.
And I would just say really quickly too, because everyone's at such a different depth and level, and where they're at with tracking or knowing their cycle, or maybe it's brand new. So I know there's so many different avenues we can go down too, but also don't get discouraged if you're starting with just knowing when your period is and how you feel around that, or just knowing around that time what certain cravings you have. You can get so in depth with tracking, which is awesome. And I'd love for each and every one of you to get down that road, but also don't think you're failing your body if you just are doing kind of basics. Like for me, I right now, I used to track a lot more consistently. And then once you get it, I track on my Garmin now pretty easily, but there's so many ways that you can be successful with a minimal time commitment, or even just like being aware of what's your poop look like today, and kind of comparing that to your emotional state and where you're at and how you feel with training. It'll get easier the more you're in tune to it too. So, hopefully that's a little plug of encouragement too, because I know if you're hearing this sometimes for the first time, it can seem super overwhelming. But the bottom line is just listen to what your body's telling you. Sometimes we're like, what is my body telling me? I don't even know. But start watching for those little signals or little signs, and it'll get easier. And then it'll just become part of life and who you are and how you move and how you train and how you eat. But it's super doable for anyone. So I hope you're all encouraged by that.
Yeah, thank you, Emily. That was important to say.
And Lauren, I saw your question about the different phases for menopausal women, and that's something I'm actually in the process of learning more about because I'm working with my mom, who's a endurance athlete as well. So so far, I don't really have as much information as I would like to have to be able to share with you, but hopefully soon we'll be able to give you more. I do know like that huge drop in estrogen that's happening in women while they're going through that menopause. It's so varied between women that there has been a hard time studying it, and there's just so many different things that the drop in estrogen causes, and the mood swings are just an unfortunate side effect of that. And a lot of depression comes from that, also the drop in serotonin. So I don't really have a lot of answers for you now, but I'm hoping soon, because I am working with my mom and trying to learn learn more so I can be educated, I guess, in helping her train.
Yeah, and I'll echo that. I have two giant books, one that's called Women's Bodies, Women's Wisdom, which is kind of the general, and then another book that's called The Wisdom of Menopause. And so that's, stay tuned as Megan and I continue to explore that. And I think I'd like to kind of break the expected or break the barrier that PMS is a normal part of a menstrual cycle, or that menopause symptoms are like an expected part of transitioning through that phase of your life. I think because it's become so common, it's become normalized, but there are definitely things that you can do and don't have to just live with it during that part of your life.
I'm
And,
gonna just speak. Sorry, I'm just gonna speak to Kara's point just there. So I'm a fellow PT with Kara and Emily. I work at KPT as well. But I had pretty significant PMS symptoms as far as like back pain as well as hip pain that I went through for years, as Kara kind of knows. There were other components to this too, but it was to the point where it would completely affect what I was able to do at the gym based on where I was with where my cycle was, and kind of turning into that, like, well, honing in and kind of understanding what was going on with my body, but then also tracking and really understanding where I was, and kind of like, oh, this isn't just a normal, like this isn't a normal part of PMS, and this isn't a normal thing that I have to go through, and I don't have to change that part of my exercise program at this point. So thank you to Kara, and also kind of just that component.
It looks like Lee has a question.
Yeah.
Hey, Lee.
Well, I have one in the text box, but I'm not sure if you can see it. I typed something, but I don't have like a send.
I was like, did you press
That's
enter?
all right. Go ahead. Go ahead now.
Huh? I'll just talk.
Go for it.
Okay. So I wanted to ask like some more information. In the beginning, Megan was talking about menopause, and I wanted to know, and just like diet and eating, you know, like less carbs, protein, more protein, you had mentioned, eating more protein. I was wondering how menopause affects like macros, and because I was wondering if it's different than like macros that people who aren't in menopause versus me.
I'll be honest, I don't know how to break down the macros quite as well, just in general, because I don't do a lot on like the counting side of things. It's more the general concept of, in menopause, it is more challenging for your body to synthesize protein to build muscle and aid recovery. Okay. That's one of the other reasons why, as you age, your muscles shrink and atrophy, and why resistive exercise is so important for that population, for all populations, but especially in those years of your life. And so I think that's all I can speak to that. I don't know the formula piece of it well enough.
Well, I have macros set up, but I'm more on higher carb and low fat, basically, instead of high fat, low carb. So I've been just using the same macros I've had. I was just curious if they would be different now. As I age, I guess.
I have a side comment. You might talk to Rochelle, because I know Rochelle does macro counting, and she was saying that she does not do well on low carb or high carb, low fat, and so she switched it. And I wonder, because I'm curious about that, because with the protein, it's hard with the fat. Sorry, side comment. I don't know anything about this, but just a thought.
Okay, thank you.
And there in this book, there is a section specifically talking about different meal plans for they've got 2 examples of different athletes in the post-menopause. And
Yeah.
they do say that they're actually, her point is most important is the protein, but in both examples she gives, there is a higher carbs and not the high fat. So
Okay.
it's going to be individual, and you may experiment with it and see how you feel. But the examples she's giving are both higher carbohydrates. Like she's saying, like 170 to 195 a day, and then the fat is a little bit lower. So,
Yeah. Anyway, I was just curious.
I will look into it for you, Lee.
Okay. I noticed some differences this year, probably in the last 8 months than before. And I'm probably, I'm very good at maintaining, which is a really good thing. Maintaining my weight. I would like to lose more. And so I was just curious about it all. If, maybe I need to rework my numbers or, the amount of calories I have to work.
Yeah.
I'm working in. So
Lee, are you in true menopause? Like,
I'm in post. I've been in post. I was in menopause. I was finished with my periods at 50.
okay, so it's been some time.
Yeah.
Okay.
Yep. Yes.
Yeah.
Thank you, Kara.
Does anyone else have any questions that they'd like our 2 experts to address while we're here? Or I'm sure they'd be more than happy to respond to questions if you think of them after the fact as well. You know where to find Kara for sure. Well, for the next week anyway.
Yes.
Nope. Looks like Pam has a question.
To unmute. There we go. What's the latest on injury risk and cycle? Because I know, like, I've blown out both my knees, and I know it was just starting. They were just starting to see a connection when I did my second one, and I was just curious what the latest was on that, or if you know.
So that, or Janae, can you go back in the graph of the phase 1, phase 2, phase 3 in the exercise portion? Yes. So in phase 1 is where basically your reaction times are going to be slower, and your ligament laxity, or how flexible you are, is at its peak. And so that is often where female ACL injuries happen, or like meniscus injuries happen. And so what they really advise during those phases is doing like adequate dynamic warm-up drills, much like what we do in CrossFit to warm up, versus like the long sustained stretches. And they've really kind of looked at that for all injury risk reduction, is that it is better to do kind of your agility drills, kind of building into the more ballistic change of direction movements gradually, basically to kind of wake your brain up, because you're just a little slower to react. That's one that I really noticed, like with double unders. There was definitely times of the month where I was like, I feel like I'm an idiot here. Like I can't do a double under for my life. And it's just because like my system had to wake up a little bit more during that period of time. So if you're thinking about granddaughters or your own daughters, really kind of trickle down approach is teaching that, you know, their menstrual cycles is a vital sign, and kind of being aware of that and where they are in their performance to encourage that. Or I think, Pam, you coach gymnastics, like, so if you're teaching in that age, helping your gymnasts know about that and really helping and make sure you're incorporating those kinds of warm-ups into their class structures, practice structures.
Thank you.
Yeah.
All right, anyone else?
By the way, I love this.
Yeah, that's awesome.
We'll do it again. Well, I think that's all we have, unless Kara or Emily want to add any parting remarks for our group. Nope. Well, we appreciate having the two of you here. Lisa?
So Emily and Kara, you said you're looking at a model for consults for this kind of stuff. Is it not available yet? Or how do we find out about that?
Emily, I'm gonna let you take the mic on that one.
Yeah, so based on what insurance reimburses, they don't reimburse on consults. So that's where we've gone on the side and started thinking, how can we still get this information to people that would benefit from it in a way that's in a realistic way. And so with that, we've started developing a cash pay program. It is in the development stages, but we're developing a program kind of focused more towards wellness and prevention, two areas that are super important. But since there's no present injury, that's where insurance won't reimburse it. So yeah, so we're in the stages of developing that from the standpoint of some wellness coaching, some more consultation like we did today on your body, nutrition, that kind of stuff. So yes, it is not established, it is in the stages. However, if anyone's super interested in it too, I'm happy to talk to you about it. You know, it's something that we could definitely delve into even in the next weeks. It's right on that brink of just getting kind of people into the program and seeing how it goes, since it's our first time doing it. So it is a little bit of a trial.
Yeah. Yeah. I mean, we would love to have, like,
absolutely,
kind of be a pilot case study for this, and would totally be willing to negotiate a price that seems reasonable. And then that way we have a starting point to compare it to. We're doing telehealth, right? So you don't even have to come to our clinic. You can do it just like this on DoxyMe. And so there's so much opportunity there. I don't want a non-established program to deter this momentum and energy.
Yeah. Right. Yeah, and we've recently started using Garmin tracking. So we have a whole dashboard that we've just implemented with KPT, where it's called the Scissors dashboard, random name, but it uses Garmin data, because we've partnered with a company that partners with Garmin to track so many components of health and well-being. So like your stress score, your body battery, your heart rate, temperature, sleep cycles, all of those. And then also with Garmin's new menstrual tracking, that's been kind of interesting too. But that is ideally could be part of our wellness coaching as well, because it really gives you a comprehensive picture of where you're at. And then after about a month of data, it establishes trends. And so that's where you can really start seeing trends that we've been able to a degree, predict, okay, we're entering a phase where it looks like your body's, doing something or another, but we can predict and say, okay, this means more exercise or less exercise, more sleep, less sleep. So it's based on a lot of trends. And that is something that I definitely, if someone wants to be kind of a pilot in that, would definitely like to collaborate with you. And if you already have a wearable Garmin device, that's fantastic too. But anyways, we can also look into getting one of those. So that's an offering as well. That's one of our newest service offerings at KPT. And that one's getting pretty well established as well.
Cool. Do you guys do at KPT, do you do any link to depression and all of this stuff?
I can't say we have like a direct link. It's more stress. We don't have that right now as an established, so yeah, I can't claim to that, but it definitely comes into play. I can tell you that, especially and think about hormone fluctuations, mood fluctuations, stress, etc. But no, we don't have like an exact established data line for that.
Thanks.
So what was that?
All right, it looks like that's all the questions for today. So thanks everyone for spending some time with us. We will get you contact information for our expert panel so that you can find Emily, Lisa. I know you're asking about that. Yeah, that's it. It was really fun to talk about these things that we don't get to talk about a lot. Hope this is just the beginning of lots more conversations down the road. Hope to see your faces at the gym soon.
Awesome.
Yay.
Thanks, everyone.
Thanks, everyone.
Bye.
Bye. Thank you.
Great job, Megan. Janae.
Yes, awesome work.
They did all of the front, like they did all the work. Emily and I just got to pop in and share knowledge bombs, but
Answer the fun questions.
was developed by them.
Yeah, well worth it. Thank you guys.
Thank you, ladies.
Thanks, guys.
Thanks for giving us more stuff to think about.
Bye.
Always so much stuff to think about. Bye.
Oops.